Hello and welcome to the second part of our discussions of some of the more commonly seen mental health diagnoses. Today we're going to talk about depression. Now, the term depression is something that's used in pop culture often to simply refer to being sad or being down for a period of time. And when a person who struggles with clinical depression says that they're depressed, it can be assumed that basically their emotions or their feelings are the same as what everybody else refers to when they speak of depression. Unfortunately, for individuals who are diagnosed with a clinical depression, they experience a lot more, and it's a lot longer and a lot more intense than your typical period of maybe feeling a little blue or a little down or a little sad. So when we're looking to diagnose clinical depression, the person will have feelings of being sad or hopeless, but they also may have increased irritability, loss of interest, and just lack of enjoyment in life. Anything they used to like to do will no longer bring them pleasure. They won't enjoy it anymore. People with clinical depression are feeling often constantly tired. They have trouble thinking. They have trouble paying attention. And they also struggle with memory, and this has to do with how depression affects the brain. There are feelings that the person has that may indicate they're feeling worthless, or their self-esteem may drop to really low. They may focus or fixate on past failures. And often there are thoughts of death, or possibly thoughts of suicide, or even suicide attempts, or sometimes suicide completions when a person is diagnosed with a clinical depression. So it's much different than what normally we refer to in our day-to-day vocabulary as depression. Now, a person who has depression, if I were going to explain it in a very simple, concrete way, is a person like depression is someone who is driving down the road with their high beams on. And if we think about all of us as kind of traveling down life's road, and our high beams are on and they're helping us see where we need to go. And then every once in a while, we all run into a bit of a fog. And so, the fog is kind of like maybe a low mood, or something happens and we're feeling sad or we're feeling heavy. And for most of us, we can just switch our high beams down to our low beams, or maybe we turn on our fog lights, or we make adjustments or whatever we need to do, and we can just keep going through the fog and come out the other side. Now, a person who struggles with clinical depression, they can't change the high beams. It's like they're stuck in that really heavy fog and they can't see a way out, because, for anybody who's tried to drive through fog with their high beams on, you can't see anything around you. You feel isolated. You feel like you don't know your way through. And most of the time, people just will slow down or stop because they don't know how to get out of where they are. And that's very much what it's like to be struggling with a clinical depression. Depression occurs, according to scientists, because of something called the monoamine deficiency hypothesis. So that's the current thinking, which basically means that one of three neurotransmitters in the brain are deficient. So it could be serotonin is one people often hear about, or dopamine deficiency. And that deficiency then results in changes to the structure of the brain. So the neurotransmitters in the brain don't have as many places to travel along. There's not as many receptors. And so it makes it more and more difficult for people to experience a happy or a high mood. We know from brain scans of people who struggle with clinical depression that there is brain shrinkage that they experience. So there are effects to the hippocampus, which is what helps with memory, with the thalamus, the amygdala, the prefrontal cortex. All of these areas experience change, physiological brain change, when a person is experiencing a clinical depression. And it's been noted by scientists that if depression symptoms are treated appropriately, then the brain can shift itself back to a more healthy state. So it's very important for anyone who is stuck and struggling in a clinical depression to recognize that your brain is not doing what it needs to do to help you feel better. And so it's best to consider possibly some medication if you're trying to get out of a clinical depression. Most of the time, people will be prescribed antidepressants, is what we commonly call them. There's a few different types, but basically what the antidepressants do is they ensure that there is enough of the feel-good neurotransmitters in the brain so that the person can reach a normal level of mood or feeling good. Now, it doesn't create extra. It doesn't add anything to the brain. It simply means that the messengers, the happiness messengers, so to speak, that the brain creates to send from one neuron to the other, it ensures that each and every one of those happiness messengers is actually used and not discarded by the brain as something that can't be used. And so it doesn't work. They don't work like, say, street drugs or any of those sorts of drugs because, antidepressants will work with chemicals already present in the body and already naturally occurring. So I hope this helped give you a little bit of a window into what depression is and how it can affect people. It's really important if you are supporting someone with depression to recognize that they are struggling to get out of where they're at. They don't want to be there, and they're not there because they have just not bothered trying to get better, or that they, aren't interested in getting out and rejoining the world. Often the additional distress people experience with clinical depression is knowing that they're missing everything that's going on around them, but they feel helpless to their emotions. They feel alone, and often they will isolate themselves away from the world. And that's happening because of how their brain is functioning. And so the best support for someone with clinical depression is for you to be there for them and to encourage them to seek some type of professional help so that they can have support to get through the depression or to get out of the fog, back onto the other side, so that their brain will start working normally again and they can continue on with life as usual. So I hope this was helpful, and I will talk to you again soon. Bye.